Hi, Dr. Haynes. My name's Erin. I wanted to talk to you about the consult we referred to you, if you have a few minutes. Okay, I wanted to talk to you about Mr. Throat. He is a 59-year-old male that we wanted to refer to a head, eyes, ears, nose, throat doctor because of some findings that we found when we saw him in our outpatient program. He is a patient of our intensive outpatient therapy program called Connections, and they're not there for a medical reason. They typically see a provider once a month, just to do a check-in on any psych medications, and if they have any complaints, they can be seen more often. So he came to us to ask about a sore throat that was bothering him. Yep. And also, he was having difficulty swallowing. So I'm just going to go through the assessment that we did using the Olcart's method for the subjective portion. The onset was 4 days ago. The location was his throat. The duration was every day, all day, and at night. The characteristics was his throat was sore on the inside and when he swallowed, and tender to touch on the outside. He felt like something was stuck in his throat. When he swallowed, he had water come back up and he was unable come up through his nose, and he was unable to swallow food. The associated factors, it's worse when he tried to swallow something, is also worse when he touched the outside of his throat. The relieving factors, he said there were none. It was getting progressively worse day by day since 4 days ago. The temporal factors it was all day, all night, and about the same all the time. The severity was the pain was moderate, but the issue is becoming quite severe because of the inability to swallow liquids and inability to swallow food. His past health history, Mr. Throat is in the outpatient program because he has an alcohol dependence history that is currently in remission. He denies any other chronic medical conditions. He denies any past surgeries. He states he takes no prescription medications. He did have a history of having sore throat, which felt similar to this, which is why he thought that's what it was. His social history is he's a pack-a-day smoker for 40 plus years. He also, until about 6 months ago, drank every day, and including binge drinking, heavy drinking every day, for over 30 years. He's currently divorced. He has no children. He does not know his family history. He's adopted, so he's unaware of any past family history, but his adopted parents did smoke and they also drank, and he kind of got started with both of those things at a young age. His review of systems, he was negative for any chills, fever, fatigue, weight loss, weight gain. He was negative for blurred vision, negative for any vision changes, negative for frequent colds, chronic sinusitis, decreased smell, denies a runny nose. He does say that he had tenderness when swallowing. He had a hoarseness to his voice, and he said that his voice had changed, which the nurse practitioner confirmed from knowing him from the outpatient program. His neck was negative for injury or stiffness or masses, but it was positive for pain. His respiratory was negative for asthma, bronchitis, negative for cough, negative for shortness of breath. His cardiovascular system, he denies any angina, chest pain, dizziness, denies exertional dyspnea, denies palpitations. His GI was negative for constipation, nausea, diarrhea, negative for vomiting, negative for rectal bleeding, and no history of GERD. His neuro was negative for headaches, negative for seizures, no neuro problems mentioned. His objective assessment was that he's a well-nourished male, awake, alert, oriented to person, place, and time, 59 years old, in moderate pain. He was afebrile. His vital signs are stable. His blood pressure is 128/82. His pulse is 89. His respirations are 20. His temperature is 98.9. His pulse oximetry is 96%, which could be due to his smoking history. We did a full assessment on his head, eyes, ears, nose, and throat, and also his neck, because that was the main area of his complaint. We also did an assessment on his lungs because of the issue with obviously something obstructing his throat to make sure he was breathing okay, and his low pulse oximetry. We also assessed his abdomen to rule out GERD, rule out mono. So I will go through his physical exam and our findings. His head was normocephalic, atraumatic. His eyes were clear bilaterally. His pupils were equal round, reactive to light and accommodation. His ears, nose, and throat. His pharynx was positive for a large growth of tissue that was, it seemed to be obstructing his ability to swallow, but not his airway. So it was pink without erythema or any other visual abnormalities. His ear canals were clear and patent bilaterally. His tympanic membranes were normal bilaterally. No sinus tenderness. No lymph nodes could be palpated. His nares were patent. His neck was positive for anterior cervical tenderness to palpation. His neck was supple. His trachea was midline. His thyroid was normal. No goiter, no JVD. His lungs were, there was no stridor. His respirations were non-labored. His lungs were clear to auscultation. There were no adventitious sounds. His abdomen was soft and non-tender. It was positive for bowel sounds in all 4 quadrants, and there was no hepatosplenomegaly. The assessment that we finally came to was that he had dysphagia, a pharynx with a visual tissue growth that needed an immediate consult, and that was to rule out neoplasm or laryngeal cancer. The differential diagnoses that we ruled out a lot of these just from the visual assessment of the growth in his throat. It looked like it was really large. It looked like the equivalent of touching tonsils, but it wasn't his tonsils. So we ruled out tonsillitis and acute epiglottitis. We did do a strep test, so we ruled out viral and strep pharyngitis, ruled out laryngeal diphtheria, a viral URI, ruled out GERD. He had no history and he had a normal abdomen exam. We ruled out hypothyroidism. He had a normal thyroid exam. We ruled out a peritonsillar abscess. There was no pus in the growth. And also we ruled out a few of these infections because he was afebrile. And again, like I said, because of the assessment. The patient's history, his extensive smoking and drinking history, and the fact that he had no knowledge of his family history related to cancer felt like put him at a high risk, and the growth in his throat just looked very suspicious for a neoplasm. Doing a self-evaluation, there are a few things I think that we probably could have done better. One of those was that we probably should have done a full neuro assessment on him because of the changes in his voice, and also because of the hoarseness and because of his inability to swallow. I mean, they fall right in line with the diagnosis of a neoplasm as well, but I just think it would have been prudent to have also done a neuro assessment, which we did not do. Another thing I think we could have done better was we took his account of the fact that when he took a sip of water, it came out his nose, but we didn't actually have him show us. So the first thing that the doctor asked when we called the doctor was, did you see this happen? And we hadn't. So as soon as we hung up, we had to ask him to do it for us. And it was just as he reported, but it would have been better if we could have said that we had already seen it. And one thing I took away from this is if you have someone in a non-acute setting that doesn't think that there's something wrong with them, and then you find out that there's something possibly pretty severe going on, just to be really calm and, not, I feel like that we made him a little nervous, but the fact that we both looked in his mouth multiple times just because the findings were so abnormal, and, and then afterwards we calmed him down, but we had to let him know what was wrong. But I think that is something that could have used improvement as well. Thank you for taking our consult.